Question 1. A nurse is caring for a client with a new prescription for digoxin. The nurse should withhold the medication and notify the prescriber if the client's apical pulse is less than which rate? A. 70 beats/minute. B. 60 beats/minute. C. 50 beats/minute. D. 40 beats/minute. Answer: B. 60 beats/minute. This question tests your knowledge of safe medication administration, specifically for cardiac glycosides like digoxin. The critical keyword here is withhold medication, which signals a safety parameter. Digoxin slows the heart rate, and administering it when the apical pulse is below 60 beats/minute could lead to dangerously slow heart rhythms, a condition known as bradycardia. Always check the apical pulse for a full minute before giving digoxin, and if it's too low, hold the dose and report it to the healthcare provider. Remember, safety first when it comes to medications that affect the heart. Question 2. The nurse is caring for a client who is NPO for surgery later today. The client asks for a sip of water. What is the most appropriate nursing response? A. A small sip of water is fine, but don't drink anything else. B. You cannot have anything by mouth, even water, to prevent complications during surgery. C. I will check with the surgeon to see if a small amount of water is allowed. D. You can have ice chips, but no water. Answer: B. You cannot have anything by mouth, even water, to prevent complications during surgery. This question addresses a fundamental safety principle in preoperative nursing care, NPO status. The keyword NPO, nil per os, meaning nothing by mouth, means absolutely no oral intake, including water, unless specifically ordered otherwise by the provider for certain situations. Consuming anything orally before surgery can increase the risk of aspiration, where stomach contents enter the lungs during anesthesia, leading to serious complications like pneumonia. It's crucial to explain the rationale to the client to ensure their understanding and compliance for their safety during the procedure. Always reinforce strict NPO guidelines to protect your client from potential aspiration risks. Question 3. A nurse is teaching a client about self-administration of insulin. Which statement by the client indicates a need for further teaching? A. I will rotate injection sites to prevent tissue damage. B. I should store my unopened insulin vials in the refrigerator. C. I will inject the insulin into the muscle for faster absorption. D. I will check my blood sugar before administering insulin. Answer: C. I will inject the insulin into the muscle for faster absorption. This question evaluates understanding of proper insulin administration technique. The keyword need for further teaching tells you to identify the incorrect statement. Insulin should be injected into subcutaneous tissue, not muscle, because injecting into the muscle can lead to unpredictable absorption and an increased risk of hypoglycemia, low blood sugar. Rotating injection sites and proper storage are correct practices, and checking blood sugar before administration is essential for dosage adjustment and safety. Remember that subcutaneous injection ensures consistent and safer absorption of insulin. Question 4. A client reports abdominal pain and is diagnosed with appendicitis. The nurse expects to find tenderness at which abdominal location? A. Left upper quadrant. B. Right upper quadrant. C. Left lower quadrant. D. Right lower quadrant. Answer: D. Right lower quadrant. This question tests your knowledge of common clinical manifestations related to specific medical conditions. The key medical term appendicitis refers to inflammation of the appendix. The appendix is located in the right lower quadrant of the abdomen, specifically at McBurney's point, and tenderness in this area is a classic sign. Understanding anatomical locations of organs and their corresponding pain patterns is essential for accurate assessment and early recognition of emergent conditions. Always associate right lower quadrant pain with potential appendicitis, especially when evaluating acute abdominal pain. Question 5. The nurse is preparing to administer a blood transfusion. Which solution is compatible with blood products and should be used to prime the foretubing? A. Dextrose 5% in water, D5W. B. 0.9% sodium chloride, normal saline. C. Lactated Ringer's solution. D. Dextrose 5% in 0.45% sodium chloride. Answer: B. 0.9% sodium chloride, normal saline. This question assesses knowledge about safe blood product administration. The keyword compatible is crucial here, as it refers to solutions that will not cause red blood cells to clump or lyse, break apart. Normal saline, 0.9% sodium chloride, is isotonic and chemically compatible with blood, meaning it will not damage red blood cells and is the only solution approved to be run with blood transfusions. Other solutions, especially those containing dextrose, can cause red blood cells to hemolyze or agglutinate, leading to a dangerous transfusion reaction. Always remember that normal saline is the universal solution for blood transfusions to maintain red blood cell integrity. Question 6. A client is receiving total parenteral nutrition, TPN. The nurse identifies a significant risk for which complication? A. Hypoglycemia. B. Hyperkalemia. C. Infection. D. Dehydration. Answer: C. Infection. This question tests understanding of potential complications associated with total parenteral nutrition, TPN. The primary keyword here is significant risk, asking for the most prominent danger. TPN is administered via a central venous catheter, which provides a direct entry point for bacteria into the bloodstream, making infection, particularly bloodstream infection, a major and life-threatening complication. While fluid and electrolyte imbalances or glucose issues, like hyperglycemia, can occur, the central line access makes infection the most critical and frequently cited risk. Always prioritize meticulous aseptic technique when caring for clients with TPN to prevent potentially fatal bloodstream infections. Question 7. A nurse is caring for a client with a chest tube following a lobectomy. The nurse notes continuous bubbling in the water seal chamber. What is the nurse's priority action? A. Document the finding as normal. B. Check the tubing and connections for leaks. C. Increase the suction setting. D. Clamp the chest tube immediately. Answer: B. Check the tubing and connections for leaks. This question assesses your knowledge of chest tube management and problem-solving skills. The keyword continuous bubbling in the water seal chamber indicates a persistent air leak in the chest tube system, which is an abnormal finding requiring intervention. The priority action is to systematically check all connections from the insertion site to the drainage system to identify and correct the source of the leak, as a leak prevents proper lung re-expansion. Clamping the tube should only be done for specific, brief circumstances, and increasing suction won't fix a leak. Always investigate continuous bubbling in a chest tube's water seal because it signals an air leak that needs immediate attention. Question 8. A nurse is providing discharge teaching to a client with heart failure. Which statement indicates the client understands dietary modifications? A. I will limit my fluid intake to 3 to 4 liters per day. B. I will add extra salt to my food for flavor. C. I will weigh myself daily and report a gain of more than 2 pounds in a day. D. I can eat as much canned soup as I want. Answer: C. I will weigh myself daily and report a gain of more than 2 pounds in a day. This question evaluates understanding of self-management for heart failure, specifically regarding fluid balance and dietary restrictions. The keyword understands indicates you are looking for the correct statement. Daily weight monitoring is a crucial indicator of fluid retention in heart failure, and a rapid weight gain, typically 2 to 3 pounds in 24 hours or 5 pounds in a week, often signals worsening fluid overload, requiring prompt notification of the healthcare provider. Clients with heart failure should restrict sodium and often fluids, so options about extra salt or unlimited canned soup, high sodium, are incorrect, and typical fluid limits are much lower than 3 to 4 liters. Remember that daily weight checks are a simple yet powerful tool for clients to monitor their heart failure status. Question 9. A client is prescribed warfarin. The nurse should educate the client about the importance of having which laboratory test monitored regularly? A. Partial thromboplastin time, PTT. B. International Normalized Ratio, INR. C. Bleeding time, BT. D. Platelet count. Answer: B. International Normalized Ratio, INR. This question tests your understanding of anticoagulant medications and their monitoring. The medication warfarin is a crucial keyword, as it's an oral anticoagulant commonly used to prevent blood clots. Warfarin's effectiveness and safety are primarily monitored using the International Normalized Ratio, INR, which standardizes prothrombin time, PT, results, ensuring consistent interpretation globally. Regular INR monitoring helps the healthcare team adjust the warfarin dose to keep the client within a therapeutic range, minimizing the risk of both bleeding and clotting. Always remember that INR is the key lab value to monitor for clients taking warfarin to ensure safe and effective anticoagulation. Question 10. A nurse is assessing a client for pain. Which assessment finding is the most reliable indicator of pain? A. Changes in vital signs. B. Client's self-report. C. Grimacing or guarding. D. Moaning or crying. Answer: B. Client's self-report. This question focuses on the fundamental principle of pain assessment. The keyword most reliable indicator points to the gold standard for measuring pain. Pain is a subjective experience, meaning only the person experiencing it can truly describe its presence and intensity. While vital sign changes, grimacing, guarding, or moaning can be indicators of pain, they are not always present, nor do they reliably reflect the client's actual pain level. A client might be in severe pain but stoic. Always trust the client's direct report of their pain as the most accurate and primary source of information. Question 11. A nurse is caring for a client with an indwelling urinary catheter. Which action is essential to prevent a catheter-associated urinary tract infection, CAUTI? A. Irrigating the catheter daily with sterile saline. B. Changing the catheter every 7 days. C. Performing perineal care daily with soap and water. D. Applying antibiotic ointment around the meatus. Answer: C. Performing perineal care daily with soap and water. This question addresses a critical aspect of infection control in clients with indwelling catheters. The keyword prevent CAUTI highlights the goal. Regular and meticulous perineal care, using soap and water to clean the area around the catheter insertion site, reduces the bacterial load that can ascend into the bladder and cause infection. Irrigating or routinely changing catheters can actually increase infection risk, and antibiotic ointment isn't routinely recommended due to resistance. Simple, consistent hygiene is paramount in preventing catheter-associated infections. Question 12. A nurse is preparing to administer an intramuscular, IM, injection to an adult client. Which site is most appropriate for a volume of 3 milliliters? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Ventrogluteal. This question tests your practical knowledge of safe medication administration, specifically regarding intramuscular injection sites and volumes. The key phrase volume of 3 milliliters is critical because different IM sites can safely accommodate different maximum volumes. The ventrogluteal site is generally considered the safest and preferred site for most IM injections in adults, especially for larger volumes up to 3 milliliters, because it is free of major nerves and blood vessels and has a thick muscle mass. The deltoid muscle is limited to smaller volumes, typically 1 milliliter, and the dorsogluteal site carries a risk of sciatic nerve injury. Always choose the ventrogluteal site for larger volume IM injections in adults for optimal safety and absorption. Question 13. A client is experiencing a severe allergic reaction to a medication, manifesting as dyspnea and hypotension. Which medication should the nurse anticipate administering first? A. Diphenhydramine, Benadryl. B. Albuterol. C. Epinephrine. D. Prednisone. Answer: C. Epinephrine. This question requires prioritization in an emergency situation, specifically anaphylaxis. The keywords severe allergic reaction, dyspnea, and hypotension describe anaphylactic shock, a life-threatening emergency. Epinephrine is the first-line medication for anaphylaxis because it acts rapidly to constrict blood vessels, raising blood pressure, relax airway smooth muscles, improving breathing, and reduce swelling. While diphenhydramine, antihistamine, and prednisone, steroid, are also used in allergic reactions, they have a slower onset and do not address the acute, life-threatening symptoms as effectively as epinephrine. In emergencies like anaphylaxis, administering epinephrine immediately is paramount to stabilize the client's airway and circulation. Question 14. The nurse is caring for a client with a new colostomy. The client expresses reluctance to look at the stoma. What is the most appropriate nursing action? A. Reassure the client that they will get used to it over time. B. Cover the stoma with a dressing until the client is ready. C. Provide emotional support and encourage the client to verbalize feelings. D. Demonstrate how to care for the colostomy independently. Answer: C. Provide emotional support and encourage the client to verbalize feelings. This question addresses psychological adaptation to a new body image and coping mechanisms. The keyword reluctance to look at the stoma indicates a potential body image disturbance and difficulty coping. The most appropriate initial nursing action is to provide a supportive environment where the client feels safe to express their emotions, concerns, and fears without judgment. This validates their feelings and is a crucial first step in the adjustment process before expecting them to engage in self-care or offering premature reassurance. Helping clients verbalize their feelings is key to building trust and facilitating their psychological adjustment to significant body changes. Question 15. A nurse is teaching a client about measures to prevent deep vein thrombosis, DVT, after surgery. Which instruction should the nurse include? A. Avoid ambulation for the first 24 hours. B. Keep legs elevated at all times. C. Perform leg exercises every 1 to 2 hours while awake. D. Apply warm compresses to the lower extremities daily. Answer: C. Perform leg exercises every 1 to 2 hours while awake. This question focuses on preventative measures for a common post-surgical complication. The keyword prevent deep vein thrombosis, DVT, guides you to choose an action that promotes circulation. Performing active or passive range of motion exercises with the legs, such as ankle pumps and foot circles, helps improve venous blood flow and reduce venous stasis, thereby lowering the risk of clot formation. Early ambulation is also encouraged, but if not possible, leg exercises are crucial. Applying warm compresses is not a primary DVT prevention strategy, and avoiding ambulation increases risk. Encourage regular leg movement and early ambulation to keep the blood flowing and prevent DVT formation after surgery. Question 16. A client in the emergency department reports crushing chest pain radiating to the left arm. What is the nurse's priority action? A. Obtain a detailed pain history. B. Administer oxygen via nasal cannula. C. Obtain an electrocardiogram, ECG. D. Administer sublingual nitroglycerin. Answer: B. Administer oxygen via nasal cannula. This question tests your ability to prioritize nursing actions in a potential cardiac emergency. The keywords crushing chest pain and radiating to the left arm strongly suggest myocardial ischemia or infarction, heart attack. The priority in such situations is to maximize oxygen delivery to the heart muscle to minimize tissue damage. Administering oxygen is a quick and immediate intervention that can help achieve this, while further assessments and interventions, like ECG and nitroglycerin, are being prepared or administered. Always provide oxygen first when a client presents with symptoms suggestive of acute cardiac ischemia to protect the heart muscle. Question 17. The nurse is preparing to administer medications through a nasogastric (NG) tube. What is the most important step to ensure proper medication delivery? A. Mix all medications together to reduce administration time. B. Crush all tablets into a fine powder. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Administer medications rapidly to prevent clogging. Answer: C. Flush the tube with 15 to 30 milliliters of water before and after each medication. This question focuses on the safe and effective administration of medications via an NG tube. The keyword most important step prompts you to identify the critical action for successful delivery. Flushing the NG tube with water before and after each medication, and often between multiple medications, ensures that the tube is patent, open, prevents clogging, and helps deliver the full dose of medication into the stomach. Mixing medications or administering them too rapidly can lead to clogging or altered absorption. Always remember that proper flushing is essential to maintain patency and ensure medication effectiveness when administering through an NG tube. Question 18. A client with type 1 diabetes mellitus is prescribed NPH insulin at 0700. When should the nurse instruct the client to be alert for signs of hypoglycemia? A. Late morning, 1000 to 1200. B. Mid-afternoon, 1600 to 1800. C. Late evening, 2200 to 0000. D. Early morning, 0200 to 0400. Answer: B. Mid-afternoon, 1600 to 1800. This question assesses your knowledge of insulin pharmacodynamics, specifically the peak action time of NPH insulin. The keyword hypoglycemia indicates a need to understand when the insulin will have its strongest effect, thus presenting the highest risk of low blood sugar. NPH insulin is an intermediate-acting insulin, and its peak action typically occurs 6 to 14 hours after administration. If given at 0700, the peak effect, and thus the highest risk for hypoglycemia, would be in the mid-afternoon. Understanding the peak times of different insulins is crucial for timing meals, monitoring clients, and preventing dangerous blood sugar drops. Question 19. A nurse is reinforcing teaching about wound care with a client who has a leg ulcer. Which statement by the client indicates effective teaching? A. I should change the dressing once a week. B. I will use hydrogen peroxide to clean the wound thoroughly. C. I will report any increased pain or redness around the wound. D. I can stop taking my antibiotics once the wound looks better. Answer: C. I will report any increased pain or redness around the wound. This question evaluates understanding of proper wound care and identifying potential complications. The keyword effective teaching indicates you are looking for the correct statement that demonstrates client understanding. Increased pain, redness, swelling, warmth, or purulent drainage around a wound are classic signs of infection or worsening inflammation, which require prompt medical evaluation. Wound dressing frequency varies based on the type of wound and dressing. Hydrogen peroxide can be cytotoxic to healthy tissue, and antibiotics should always be completed as prescribed, even if symptoms improve, to prevent antibiotic resistance. Always teach clients to recognize and report signs of infection to ensure timely intervention and proper wound healing. Question 20. The nurse is caring for a client with a history of alcohol withdrawal. Which medication should the nurse anticipate administering to prevent complications such as seizures and delirium tremens? A. Lorazepam, Ativan. B. Haloperidol, Haldol. C. Disulfiram, Antabuse. D. Thiamine, vitamin B1. Answer: A. Lorazepam, Ativan. This question focuses on managing alcohol withdrawal syndrome safely. The keywords alcohol withdrawal, seizures, and delirium tremens indicate the severe, potentially life-threatening complications. Benzodiazepines, such as lorazepam, Ativan, are the first-line treatment for alcohol withdrawal because they act on the central nervous system to reduce neuronal hyperactivity, thereby preventing or managing tremors, agitation, seizures, and delirium tremens. Haloperidol is an antipsychotic. Disulfiram helps maintain sobriety but isn't for acute withdrawal, and thiamine prevents Wernicke-Korsakoff syndrome, which is a different complication. Always remember that benzodiazepines are crucial for safely managing the acute symptoms and preventing severe complications of alcohol withdrawal. Question 21. A nurse is assessing a client with fluid volume deficit. Which finding would the nurse expect? A. Bounding peripheral pulses. B. Increased urine output. C. Dry mucous membranes. D. Elevated blood pressure. Answer: C. Dry mucous membranes. This question tests your ability to identify clinical manifestations of fluid imbalance. The keyword fluid volume deficit indicates dehydration, meaning the body lacks sufficient fluid. Dry mucous membranes, along with decreased skin turgor, thirst, decreased urine output, rapid weak pulse, and hypotension, are classic signs of dehydration as the body tries to conserve fluid. Bounding pulses, increased urine output, unless due to diuretics and fluid overload, and elevated blood pressure are typically signs of fluid volume excess or other conditions, not deficit. When assessing for fluid volume deficit, always look for signs of dryness and decreased perfusion. Question 22. A nurse is preparing to administer a tuberculin skin test, Mantoux test. Which route of administration is correct for this test? A. Subcutaneous. B. Intramuscular. C. Intradermal. D. Intravenous. Answer: C. Intradermal. This question assesses knowledge of specific diagnostic test procedures. The key phrase, tuberculin skin test, Mantoux test, directly links to the correct route of administration. The Mantoux test requires a small amount of purified protein derivative, PPD, to be injected into the dermal layer of the skin, just below the epidermis, to create a visible wheal or bleb. This shallow injection allows for a localized immune response that can be measured, unlike subcutaneous, intramuscular, or intravenous injections which deliver medication deeper into the body. Always remember that a successful Mantoux test results in a visible wheal, a sign of correct intradermal administration. Question 23. A nurse is caring for a client with a new diagnosis of type 2 diabetes mellitus. Which of the following is the most important initial teaching point regarding diet? A. Eliminate all carbohydrates from the diet. B. Consume a consistent amount of carbohydrates at each meal. C. Eat only sugar-free foods. D. Increase intake of saturated fats. Answer: B. consume a consistent amount of carbohydrates at each meal. This question focuses on initial dietary education for a client with type 2 diabetes. The keywords most important initial teaching guide you to a foundational principle. While carbohydrate counting and portion control are key, maintaining a consistent carbohydrate intake at meals and snacks helps to prevent sharp fluctuations in blood glucose levels, making it easier to manage blood sugar with medications and lifestyle choices. Eliminating all carbohydrates is impractical and unhealthy. Sugar-free foods still often contain carbohydrates, and increasing saturated fats is detrimental to cardiovascular health. Teach clients to be consistent with their carbohydrate intake to achieve better blood sugar control. Question 24. A client reports severe anxiety and hyperventilation, experiencing tingling in the fingers and around the mouth. The nurse recognizes these symptoms are most likely related to which acid-base imbalance? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Answer: B. Respiratory alkalosis. This question tests your understanding of acid-base imbalances and their clinical manifestations. The keywords anxiety, hyperventilation, and tingling in the fingers and around the mouth are classic signs. Hyperventilation, rapid, deep breathing, causes the body to exhale too much carbon dioxide, CO2, leading to a decrease in carbonic acid in the blood and an increase in blood pH, resulting in respiratory alkalosis. The tingling, paresthesias, is a common symptom due to the altered calcium ionization secondary to alkalosis. Remember that too much breathing out CO2 leads to respiratory alkalosis, often seen with anxiety and panic attacks. Question 25. A nurse is educating a client about prescribed furosemide, Lasix. The nurse should instruct the client to increase intake of which food group? A. Foods high in sodium. B. Foods high in potassium. C. Foods high in calcium. D. Foods high in magnesium. Answer: B. Foods high in potassium. This question tests your knowledge of common diuretic side effects and client education. The medication furosemide, Lasix, is a loop diuretic, and the key action of loop diuretics is to excrete potassium along with fluid, putting the client at risk for hypokalemia, low potassium. To counteract this, clients are often advised to increase their intake of potassium-rich foods, example bananas, oranges, potatoes, spinach, or may be prescribed a potassium supplement. Sodium intake is usually restricted for clients taking diuretics due to fluid retention. Remember that Lasix makes you lose K+, potassium, so increasing potassium intake is crucial. Question 26. The nurse is caring for an older adult client who frequently experiences nocturia. Which intervention should the nurse recommend to reduce nighttime awakenings? A. Drink a large glass of water before bed. B. Limit fluid intake in the evening. C. Increase caffeine consumption during the day. D. Take a diuretic medication before bedtime. Answer: B. Limit fluid intake in the evening. This question addresses a common issue in older adults and practical nursing interventions. The keyword nocturia refers to frequent urination at night. Limiting fluid intake, especially fluids containing diuretics like caffeine or alcohol, several hours before bedtime can significantly reduce the need to urinate during the night, thereby improving sleep quality. Drinking a large glass of water before bed or taking a diuretic at night would exacerbate nocturia. Encourage clients to shift most of their fluid intake to earlier in the day to minimize nighttime bathroom trips. Question 27. A nurse is preparing a sterile field for a dressing change. Which action by the nurse maintains surgical asepsis? A. Placing sterile instruments directly on the bedside table. B. reaching across the sterile field to retrieve an item. C. Keeping sterile gloved hands above the waist level. D. Turning away from the sterile field to grab supplies. Answer: C. Keeping sterile gloved hands above the waist level. This question tests your understanding of principles of surgical asepsis, which aims to prevent contamination of sterile areas. The keyword maintains surgical asepsis directs you to identify the correct sterile technique. Anything below waist level or out of the nurse's direct line of sight is considered contaminated. Reaching across the sterile field, placing sterile items on non-sterile surfaces, or turning away from the field all compromise sterility. Always keep sterile hands and instruments within your sight and above waist level to prevent accidental contamination. Question 28. A client is receiving opioids for pain management. The nurse should assess for which common adverse effect? A. Diarrhea. B. Bradycardia. C. Respiratory depression. D. Hypertension. Answer: C. Respiratory depression. This question focuses on the essential safety monitoring for opioid analgesics. The keyword opioids should immediately bring to mind their most serious dose-dependent adverse effect, respiratory depression, characterized by a decreased respiratory rate and depth. While constipation, not diarrhea, hypotension, not hypertension, and sometimes bradycardia can occur, respiratory depression is the life-threatening complication that requires vigilant monitoring and is the primary reason for overdose fatalities. Always monitor respiratory rate and sedation levels closely when a client is receiving opioids to ensure their safety. Question 29. A nurse is preparing a discharge plan for a client with newly diagnosed type 1 diabetes mellitus. Which information is most important for the client to understand for safe self-management? A. How to rotate insulin injection sites. B. The importance of annual eye exams. C. How to recognize and treat hypoglycemia. D. The long-term complications of diabetes. Answer: C. How to recognize and treat hypoglycemia. This question prioritizes essential discharge teaching for a client with type 1 diabetes. The phrase, most important for safe self-management, guides you to the most immediate life-threatening concern. Hypoglycemia, low blood sugar, is an acute and potentially severe complication of insulin therapy that can lead to seizures, coma, or even death if not promptly recognized and treated. While all other options are important long-term aspects of diabetes management, the ability to manage hypoglycemia is crucial for immediate client safety at home. Always prioritize teaching clients how to recognize and treat hypoglycemia because it's the most urgent complication they may face. Question 30. A client with a urinary tract infection, UTI, is prescribed an antibiotic. The nurse should instruct the client to consume increased amounts of which fluid to help flush bacteria from the bladder? A. Coffee. B. Cranberry juice. C. Milk. D. Carbonated soft drinks. Answer: B. Cranberry juice. This question assesses knowledge of common nursing interventions for urinary tract infections. The keyword flush bacteria highlights the goal. While increased overall fluid intake is beneficial for UTIs, cranberry juice is often recommended because it contains compounds, proanthocyanidins, that can prevent bacteria, particularly E. coli, from adhering to the bladder walls, thereby aiding in their expulsion. Coffee, milk, and carbonated soft drinks do not have this specific benefit and may even irritate the bladder in some individuals. Encourage cranberry juice and increased water intake to help prevent bacterial adherence and promote bladder emptying. Question 31. A nurse is performing CPR on an adult client. What is the correct compression depth for an adult? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. no more than 1.5 inches 3.8 centimeters. D. No more than 3 inches 7.6 centimeters. Answer B. At least 2 inches 5 centimeters. This question tests a fundamental skill in emergency nursing, CPR. The keyword compression depth is critical for effective chest compressions. According to current guidelines, adult chest compressions should be at least 2 inches 5 centimeters deep but no more than 2.4 inches 6 centimeters, allowing for full chest recoil between compressions. Adequate depth is necessary to create sufficient blood flow to vital organs like the brain and heart. Remembering that at least 2 inches guideline ensures you're delivering effective compressions during CPR, which is crucial for client outcomes. Question 3-2. A client has a prescription for airborne precautions. Which personal protective equipment, PPE, should the nurse wear upon entering the client's room? A. Surgical mask and gloves. B. N95 respirator mask. C. Gown and gloves. D. Face shield and gown. Answer B. N95 respirator mask. This question assesses your knowledge of infection control and transmission-based precautions. The key phrase airborne precautions indicates a specific type of transmission. Airborne precautions are used for diseases spread by very small airborne droplets that can remain suspended in the air for long periods, such as tuberculosis or measles. Therefore, an N95 respirator mask, or higher-level respiratory protection, is essential to filter these tiny particles and protect the nurse's respiratory system. Standard surgical masks do not provide adequate protection against airborne pathogens. Always wear an N95 respirator when caring for clients on airborne precautions to protect yourself from inhaling infectious particles. Question 33. The nurse is caring for a client experiencing a grand mal seizure. What is the nurse's priority action during the seizure? A. Restrain the client to prevent injury. B. Insert an oral airway to maintain patency. C. Protect the client's head and ensure a safe environment. D. Administer intravenous antiepileptic medication immediately. Answer C. Protect the client's head and ensure a safe environment. This question tests your ability to prioritize safety during a seizure. The keyword priority action during the seizure emphasizes immediate safety. The most crucial nursing action during a grand mal, tonic-clonic, seizure is to protect the client from injury by patting surfaces, removing objects, and cushioning their head, while not restraining them, which can cause injury. Attempting to insert an oral airway can cause injury and is generally contraindicated, and administering medications might be difficult or unsafe during the active seizure. Focus on client safety by creating a clear, protected space around them during a seizure. Question 34. A nurse is teaching a parent about car seat safety for a newborn. Which statement by the parent indicates a need for further teaching? A. The car seat should be placed in the back seat, facing the rear. B. I should make sure the harness straps are snug and at or below the baby's shoulders. C. I can place the car seat in the front passenger seat if the airbag is turned off. D. The car seat should be reclined at a 45-degree angle. Answer C. I can place the car seat in the front passenger seat if the airbag is turned off. This question assesses understanding of essential newborn safety, specifically car seat use. The keyword need for further teaching means you're looking for the incorrect statement. Infants and young children should always ride in the back seat to minimize risks associated with airbags, even if turned off, as airbags can still pose a danger or interfere with proper car seat function. Rear facing in the back seat, snug straps at or below the shoulders, and a 45-degree recline are all correct safety guidelines. Always emphasize that the safest place for a car seat is in the back seat, regardless of airbag status. Question 35. A nurse is assessing a client with a full-thickness burn injury. Which characteristic of the burn would the nurse expect? A. Red, painful, and blistering. B. Blanched, dry, and painless. C. Red, moist, and painful. D. Redness with mild swelling. Answer: B. Blanched, dry, and painless. This question tests your knowledge of burn classifications and their characteristics. The keyword full-thickness burn refers to a third-degree burn, which involves destruction of the epidermis, dermis, and often subcutaneous tissue. Because nerve endings are destroyed in a full-thickness burn, the area appears dry, leathery, waxy, or blanched, white/pale, and is often painless. Redness, pain, and blistering are characteristic of superficial or partial thickness burns. Understanding these characteristics helps in accurate assessment and guides initial management. A full-thickness burn often looks less severe than it is because there's no pain due to nerve damage. Question 36. A nurse is providing care for a client who is actively hallucinating. What is the most therapeutic nursing intervention? A. Tell the client that the hallucinations are not real. B. Reinforce the reality by stating what is real and distracting the client. C. Agree with the client's perception to build trust. D. Ignore the client's statements about the hallucinations. Answer: B. Reinforce the reality by stating what is real and distracting the client. This question addresses therapeutic communication and intervention for clients experiencing hallucinations. The keyword most therapeutic indicates the best approach. It's important not to argue with the client about the reality of their hallucinations, but also not to agree with them. Instead, gently reinforce reality by stating what is true in the environment and then redirect the client's attention to a more reality-based topic or activity. For example, I don't see anyone else in the room, but I can see you're feeling anxious right now. Let's talk about what's making you anxious. Validating their feelings while correcting misperceptions is key. Question 37. The nurse is caring for a client with a history of recurrent falls. Which nursing intervention is most effective in preventing future falls? A. Keeping all 4 bed rails up at all times. B. Placing the client in a room close to the nursing station. C. Initiating an individualized exercise program for strength and balance. D. Administering a sedative at bedtime to promote sleep. Answer: C. Initiating an individualized exercise program for strength and balance. This question focuses on fall prevention, specifically for a client with a history of recurrent falls. The keyword most effective prompts you to choose an intervention that addresses the root cause and provides lasting benefit. While bed rails and proximity to the nursing station can be part of a safety plan, improving a client's physical strength, balance, and gait through an individualized exercise program is a proactive and highly effective strategy for reducing fall risk long-term. Sedatives can actually increase fall risk. Focus on empowering clients to regain physical stability through targeted exercises to truly prevent future falls. Question 38. A client is prescribed nitroglycerin for chest pain. The nurse should instruct the client to take how many doses, 5 minutes apart, before calling emergency services? A. 1 dose. B. 2 doses. C. 3 doses. D. 4 doses. Answer: C. 3 doses. This question tests your knowledge of emergency management for chest pain using nitroglycerin. The keywords nitroglycerin and chest pain indicate a potential cardiac event. The standard guideline is that if chest pain is not relieved or worsens after the first dose of sublingual nitroglycerin, the client should take a second dose after 5 minutes, and if still unrelieved, a third dose after another 5 minutes, at which point emergency medical services, EMS, should be called immediately if not already done. This take 3 Call 911 rule is crucial for timely intervention in a heart attack. Remember, do not delay calling for help if chest pain persists after 3 nitroglycerin doses. Question 39. A nurse is providing care for a client with Clostridium difficile, C. difficile, infection. Which infection control measure is most critical? A. Wearing a surgical mask when in the client's room. B. Using an alcohol-based hand sanitizer after client contact. C. Performing hand hygiene with soap and water after client contact. D. Wearing a gown and gloves for all client interactions. Answer: C. Performing hand hygiene with soap and water after client contact. This question specifically addresses infection control for Clostridium difficile. The key phrase, most critical, emphasizes the unique nature of C. difficile spores. While gowns and gloves are essential for contact precautions, alcohol-based hand sanitizers are ineffective against C. difficile spores. Therefore, meticulous hand-washing with soap and water for at least 20 seconds is the most critical and effective way to remove C. difficile spores from hands and prevent transmission. Remember that for C. difficile, alcohol is no match, only soap and water will do for hand hygiene. Question 40. A nurse is monitoring a client who is receiving intravenous, 4, fluids. Which finding indicates fluid overload? A. Decreased blood pressure. B. Peripheral edema. C. Dry mucous membranes. D. Increased heart rate with weak pulses. Answer: B. Peripheral edema. This question tests your ability to recognize signs of fluid imbalance. The keyword fluid overload indicates excessive fluid in the body. Peripheral edema, or swelling in the extremities, often ankles and feet, is a classic sign of fluid moving from the intravascular space into the interstitial spaces due to excess fluid volume. Decreased blood pressure, dry mucous membranes, and increased heart rate with weak pulses are typically signs of fluid volume deficit, dehydration, not overload. When assessing for fluid overload, always check for swelling in dependent areas like the ankles and sacrum. Question 41. A nurse is preparing to administer medications to a client. Which of the rights of medication administration helps ensure the client receives the correct drug? A. Right time. B. Right route. C. Right medication. D. Right documentation. Answer: C. Right medication. This question focuses on the core principles of safe medication administration. The keyword correct drug directly links to the right medication principle, which is one of the foundational 5 rights, now often expanded to 6, 7, or more. This right emphasizes the importance of verifying the medication name against the prescriber's order and the client's allergy list before administration. While the other rights are also crucial for safe practice, only checking the right medication directly addresses whether the specific drug itself is correct. Always double-check the medication label against the order to ensure you're giving the right drug to the right client. Question 42. A nurse is caring for a client with a nasogastric (NG) tube connected to low intermittent suction. Before administering a medication, what should the nurse do with the suction? A. Increase the suction to high continuous. B. Clamp the NG tube for 30 to 60 minutes after medication administration. C. Turn off the suction for 30 to 60 minutes after medication administration. D. Administer the medication with the suction running to ensure absorption. Answer: C. Turn off the suction for 30 to 60 minutes after medication administration. This question assesses practical knowledge for medication administration with an NG tube. The key action here is related to suction. If the NG tube is connected to suction, the medication will be immediately suctioned out before it has a chance to be absorbed. Therefore, it is essential to turn off the suction for at least 30 to 60 minutes, Check facility policy for exact time after administering medications to allow for proper absorption. Simply clamping the tube won't stop the previous suction from removing the medication. Always pause suction after giving NG tube medications to ensure they can be absorbed effectively. Question 43. A nurse is teaching a client with osteoporosis about dietary choices. Which food should the nurse recommend to promote bone health? A. Red meat. B. Whole milk. C. Spinach. D. Fortified cereal. Answer: D. Fortified cereal. This question tests your knowledge of nutrition and bone health, specifically for osteoporosis. The keywords osteoporosis and promote bone health point to the need for calcium and vitamin D. While milk, option B, is a good source of calcium, many clients might have lactose intolerance or dietary restrictions. Fortified cereals are excellent sources of both calcium and vitamin D, which are crucial for calcium absorption and bone mineralization. Spinach contains calcium but also oxalic acid, which can inhibit absorption, and red meat is not a primary source of bone-building nutrients. Look for foods fortified with calcium and vitamin D, as they provide an accessible way to boost these vital nutrients for bone health. Question 44. A nurse is caring for a client who is receiving intravenous potassium chloride. Which action is essential for the nurse to take? A. Administer as a rapid 4 bolus. B. Administer undiluted. C. Monitor for signs of hyperkalemia. D. Administer via intramuscular injection. Answer: C. Monitor for signs of hyperkalemia. This question addresses the safe administration of intravenous potassium chloride. The keyword essential highlights a critical safety measure. Potassium is a high-alert medication, and rapid infusion or excessive amounts can lead to dangerously high serum potassium levels, hyperkalemia, which can cause life-threatening cardiac dysrhythmias. Therefore, the nurse must continuously monitor the client's cardiac rhythm and signs of hyperkalemia, such as muscle weakness, paresthesias, and changes on the ECG, example tall peak T waves. Potassium should never be given as a rapid 4 bolus, undiluted, or intramuscularly. Always remember that 4 potassium must be given slowly and diluted, with vigilant monitoring for hyperkalemia. Question 45. A nurse is providing discharge teaching to a client after cataract surgery. Which instruction is most important to prevent complications? A. Avoid bending at the waist and heavy lifting. B. Resume normal activities, including driving, immediately. C. Rub the eye gently if it feels itchy. D. Remove the eye patch as soon as possible. Answer: A. Avoid bending at the waist and heavy lifting. This question focuses on postoperative care following eye surgery. The phrase, most important to prevent complications, guides you to a critical safety measure. After cataract surgery, it is crucial to avoid activities that increase intraocular pressure, IOP, such as bending, stooping, lifting heavy objects, straining, or coughing. Increased IOP can put stress on the surgical site and potentially lead to complications like hemorrhage or wound dehiscence. Rubbing the eye can cause damage, and immediate resumption of normal activities or early patch removal can also cause harm. Always teach clients to avoid activities that increase pressure in the eye after surgery to protect the healing process. Question 46. A nurse is assessing a client for dehydration. Which laboratory value would the nurse expect to be elevated? A. Serum sodium. B. Hematocrit. C. Blood glucose. D. Serum potassium. Answer: B. Hematocrit. This question tests your understanding of laboratory changes in fluid imbalances. The keyword dehydration indicates a state of fluid volume deficit. When a client is dehydrated, the plasma volume decreases, leading to a higher concentration of red blood cells within the remaining fluid. This results in an elevated hematocrit, as the percentage of red blood cells in the blood appears higher due to less fluid. While serum sodium can be affected, hematocrit is a direct indicator of hemoconcentration due to fluid loss. Think of it like this: if you have less water in your bloodstream, the blood cells become more concentrated, making the hematocrit go up. Question 47. A nurse is caring for a client with a new peripherally inserted central catheter, PICC, line. Which action is essential to maintain patency and prevent infection? A. Flushing the line with normal saline once daily. B. Changing the dressing every 24 hours. C. Performing a scrub-the-hub technique before accessing the line. D. Administering antibiotics prophylactically. Answer: C. Performing a scrub-the-hub technique before accessing the line. This question addresses critical care for central venous access devices. The keywords PICC line, patency, and prevent infection emphasize the need for meticulous aseptic technique. The scrub-the-hub technique, involving vigorous scrubbing of the catheter hub with an antiseptic, example chlorhexidine or alcohol, for a specified duration, example 15 seconds, before each access, is essential to disinfect the access port and prevent microorganisms from entering the bloodstream, thereby reducing the risk of catheter-associated bloodstream infections. Daily flushing and regular dressing changes are also important, but scrubbing the hub before every access is paramount. Never skip the scrub-the-hub technique. It's your primary defense against central line-associated infections. Question 48. A nurse is preparing to administer a medication that requires a high alert designation. What is the nurse's priority action regarding this medication? A. Administer it immediately without a second check. B. Have another nurse independently verify the medication and dosage. C. Store it in a separate, locked medication drawer. D. Administer it only during specific hours of the day. Answer: B. Have another nurse independently verify the medication and dosage. This question focuses on medication safety, specifically for high-alert medications. The keyword high alert signifies medications that carry an increased risk of causing significant client harm when used in error. For these medications, independent double-checking by another qualified healthcare professional, example another nurse, is a critical safety measure to detect potential errors in prescribing, dispensing, or administration before they reach the client. This second check minimizes the risk of severe adverse events. Always perform an independent double-check for high-alert medications to add an extra layer of safety. Question 49. A nurse is providing education to a client prescribed a new medication for hypertension. Which statement indicates the client understands the teaching? A. I will stop taking this medication if my blood pressure returns to normal. B. I should limit my intake of fruits and vegetables while on this medication. C. I will take my blood pressure at home regularly and keep a record. D. I can take a double dose if I forget to take it. Answer: C. I will take my blood pressure at home regularly and keep a record. This question assesses client understanding of medication adherence and self-management for hypertension. The keyword understands indicates you are looking for a correct statement. Regular home blood pressure monitoring is crucial for clients with hypertension because it provides valuable data on medication effectiveness and helps identify trends or issues, empowering the client in their self-management. Stopping medication when blood pressure normalizes is dangerous, as hypertension often requires lifelong treatment. Limiting healthy foods or taking double doses are incorrect and potentially harmful actions. Empower clients to monitor their blood pressure at home regularly. It's a key step in effective hypertension management. Question 50. A nurse is assessing a client with a fractured tibia in a cast. Which finding would indicate a potential complication of compartment syndrome? A. Mild swelling around the cast edges. B. Pain that is relieved by elevation and analgesia. C. Capillary refill of 2 seconds in the toes. D. Increased pain despite analgesia and passive stretching. Answer: D. Increased pain despite analgesia and passive stretching. This question assesses your ability to recognize signs of a serious orthopedic complication. The key medical term, compartment syndrome, refers to increased pressure within a confined space, facial compartment, that compromises circulation and nerve function. The classic and most concerning sign of compartment syndrome is disproportionate pain that is severe, unrelieved by elevation or standard analgesics, and often worsens with passive stretching of the affected muscles, the pain on passive stretch symptom. While mild swelling and normal capillary refill are expected, persistent, worsening pain is a critical red flag indicating impaired tissue perfusion. Always consider compartment syndrome when pain seems excessive for the injury and doesn't respond to typical pain relief measures.